So, Laurie, Maxine Waters and others, they've admitted that the shutdown is about health care, and Maxine Waters and others have said, yes, that includes everybody, illegal aliens. Is this the fight that the Democrats really should have?
This is not about illegal immigrants. That is what the Republican Party and the GOP and Donald Trump want Americans to think that this is about, but it is not. A Washington Post poll recently said that the blame that the American public sees is squarely on the GOP and Donald Trump at 48%, with 30% being for the Democrats. And then there's a toss-up of 23% who aren't sure because they don't know right now. The longer this shutdown continues to go on, the American public becomes extremely aware of what's happening. And this is the GOP, Donald Trump, controlling Americans' health care, including mine. I am not an illegal immigrant. I am here. I am a U.S. citizen, and those people that are also documented are able to receive health insurance. And you have to have a social security number, I want to be very clear, to have any ACA benefits. I'm not talking about Medicaid and Medicare because that's not what this shutdown is about. It is about the Affordable Care Act, which Republicans like to call Obamacare. I worked in that administration. Yes, we worked very hard to make sure that most Americans in this country, once they get into the marketplace, that they have that coverage. I am one of them here in the state of Virginia. 4.8 million people will lose their health insurance starting January 1st of 2026 if these subsidized ACA credits go away. People's premiums are already starting to go up and those notices are starting to go out. This is not about immigration. This is not about undocumented people. This is about the GOP clearly stating that they want to inflict as much pain as possible onto the American people and blame it on the Democrats. They're doing with this also with the shutdown because people have lost their jobs. Federal workers are sitting here wanting to go back to work. TSA agents, all the federal workers across this country. But let's just focus on TSA and the FAA right now. Shouldn't we want qualified and the right amount of people on these jobs right now and not putting more stress and risk on these folks they're doing such important jobs? They're just one drop in the bucket of a federal employee that we're talking about here over healthcare.